Hi, good morning. I am Sharon Burgess. I work as a lactation counselor to all the mothers helping in for the lactation. So today what we are talking about is regarding two things, that is position and latching. Now in positioning there are 4 points that we need to consider. First, comfortable position to the mother. Second, making sure that the baby is in a proper position. Third, bringing the baby to the breast and tummy to tummy. So, the first, comfortable position. So, you need to make sure that the mother is in a proper position, sitting in upright position, supporting the back. Okay, always. Second, bringing the baby towards the breast. So, you need to hold the baby as I demonstrate. You need to hold the baby towards the body of the mother. Seeing the alignment wherein the baby's head should be turned towards the breast, opposite to the breast, the back is straight in a proper alignment with the head, tummy to tummy. That is the fourth point, wherein the baby's tummy it is touching the mother's body. So these are the things that we need to consider. So if you follow these 4 points, we will be able to have a proper position. Coming to the different positions that we can follow. So in different positions, there are 5 positions that we use. Laid back position, second is cradle position, cross cradle, football position, and the last one is the sideline position. Now, the laid back position is a position used by most of the mothers second or third post-op day of cesarean section, wherein the mother can easily lay back and hold the baby on towards her for feeding. So this is kind of position which will be used on the second day and third day of cesarean section for the comfortness of the mother as well as for the baby. Next, coming to the most commonest one, that is the cradle position. In cradle position, the same hand and the same breast is being used to hold the baby. So this is how you hold the baby. Same hand, same breast, the baby's head is opposite to the breast and in a proper alignment. Okay, so this is cradle position. Next, coming to the cross cradle position. In cross cradle position, opposite hand towards the opposite breast. So you are holding the baby onto the opposite hand and feeding with the opposite breast. So there are two things that you need to keep it in mind during this feeding, wherein you should never hold the head of the baby. You should always support the baby onto the neck and to the shoulders and hold it. Second thing, always use a C method to hold the breast. You should never use the scissor method. So these are the two things that you need to consider when you are giving cradle and cross cradle positions. Coming to the next, that is football position. Now football position is used for mothers who are having twin babies, wherein they have to feed both the child at the same time. So what they can use is football position. So you will hold both the babies on both the hand. Points to be noted, you will never hold the baby by the head. You will always support it through the neck and hold the shoulders and support. So this is how you will place the baby for feeding, wherein you can either support their back through the hand of the mother, or you can keep a pillow so wherein the baby will be lying, and you just tell the mother to hold the neck and shoulder of the baby and support the baby. So this is the most common method or common position used by the mothers who are having twins. This is called as football position. And the last one is the sideline position. Sideline position is when the mothers are like, if they are very tired and they need to feed the baby still then they can use sideline position. So in sideline position, the mother will be turning towards one side, and you should make sure the baby is also turning towards the mother. So if I show you the position, this should be the position when you are giving sideline position, wherein the alignment of the baby is the same. Head of the baby is towards the breast, opposite to the breast, and the mother is also at the sideline position. Baby's tummy is touching the mother's body. So these are the different positions that we'll be using for breastfeeding. Now, with breastfeeding or with the positions comes something called as latching, which is as much as important in consideration of breastfeeding. Now, if there is proper latching, the main thing how it helps is there will be no nipple crack, there will be no pain during the breastfeeding, and easy flow of the breast milk to the baby. This is how a proper good latch will help the baby to have or and the mother to have a good breastfeeding. So what are the points that need to be considered for a good latch? Now in good latch, as I said, opposite to the head should be always opposite to the breast, or the second thing that we can consider, the nose of the baby should touch the breast. So that is one thing in the latching. Second, we should always see that the mouth of the baby is wide open. Whenever you should never force in the breast to the babies, so you should always bring the baby near to the breast, wait for the baby to open their mouth wide open, and as they open wide open, that is the time when you should give the breast to the baby. So my wide mouth open should be present. The next point that you will be observing in the babies are the chin is touching the breast. So the chin of the baby, the lower chin of the baby should touch the lower part of the breast. That is the third point. And flanged out the lips. Flanged out the lips means fish lips. Like it should be wide open and outward so that the proper areola and the nipple is inserted into the mouth of the baby. So these are the different points that you need to take into consideration for a good latch, and this will help in like there would be no nipple crack, there would be no pain for the mothers, because usually mothers come with a complaint of pain while giving the breastfeeding. That will be only and only because there is no proper latch given to the baby, and that is why the mother is experiencing pain. As we have already discussed the latching and the points to be of the latching, now we will see a picture which says about good latch and a bad latch. So if you can see in the picture, the good latch, the whole nipple and the areola. As I demonstrate, the nipple as well as the whole areola is being taken into the mouth of the baby. And the other picture shows you regarding the bad latch, wherein the baby mouth is only open little and it has taken only the nipple. So that tells you that it is a bad latch. So you have to teach the mothers even to tell them like how to identify the good latch and the bad latch, and the points we have discussed regarding the latching. So in both the pictures you can clearly understand that in good latch the whole areola is being taken, the baby's mouth is wide open, the lower chin of the baby is touching the breast of the mother, and the lower lip is towards outward, that is flanged lips outward you can see. So these are the points that we had covered, and the same thing is being covered in the picture as good latch and bad latch. Hope this video was useful and I have helped you to know regarding the latching and the positioning of the child. Thank you.